welcome you to come back on camera, come off of mute, and actually ask a question so that we can have a little bit of interaction that way as well. And so now I'm very excited to introduce our guest presenter today, Dr. George Khalil. He is an assistant professor in the Department of Health Outcomes and Biomedical Informatics at the University of Florida, and he specializes in the application of health communication strategies for behavior change. His work primarily focuses on the design and evaluation of entertainment programs and technology-based interventions that aim to improve clinical and behavioral outcomes related to cancer prevention and control among youth. He's particularly passionate about the application of games for health to bring about behavior change. Most recently, his research has focused on tobacco prevention, exploring adolescents' reactions to Aspire, which is a web-based smoking prevention program, and the study of young adults' experience with mobile health campaign for tobacco risk communication. He's also conducted studies on Remission, which is a video game designed to improve medication adherence among young adult college students. Among pediatric cancer patients and cancer risk communication among young adult college students. Funded by an R00 grant from the National Institute on Drug Abuse, Dr. Khalil is currently developing and testing social game for tobacco prevention among adolescents. He's presented at both national and international conferences, including the World Cancer Congress, and has been the recipient of a variety of awards, including the Early Career Investigator Award from the Society for Research on Nicotine and Tobacco, which I just came back from, missed you seeing there, and a New Investigator Workshop Award from the American Society of Preventive Oncology. Without further ado, Dr. Khalil, I invite you to share your screen and get us started.
Okay, thank you so much, Erica, for this introduction, and it's really an honor for me to be here. I'm excited to be presenting to you sharing with you my personal journey today through entertainment education, leading on to games for health research, and provide kind of a brief insight into the mechanisms that can impact public health through games for health. So, quick overview of my journey. So I started my career in public health at USC in Los Angeles, where I became very interested in entertainment-based strategies for health promotion. Being close by Hollywood, I got excited to collaborate with the Hollywood industry, entertainment industry down in LA to introduce health messages about different topics into medical drama and apply that for my master's in public health back at USC. And this early experience led me to wanting to continue with a PhD in communication, specializing in health. And I went on to the University of Buffalo, New York, where I completed my PhD in health communication. And then that's where I got exposed to games for health and began my career, my really dream career of working with entertainment-based digital interventions and gameplay as a mean for health promotion, education, and risk communication. And so I joined MD Anderson Cancer Center in Houston for a series of NCI-funded fellowships, pre-doctoral and postdoctoral fellowships, that got me to kind of explore users' experience, research participants' experience with digital health when it's entertainment-based, and how to apply these strategies, particularly with adolescents, looking at tobacco prevention. And that led me to a career in the design and testing of health interventions that apply entertainment-based strategies, particularly for games for cancer prevention and control, and led on with the K99 R00 award that allowed me to move on at the assistant professorship at the University of Florida. So doors that open bring about more more experiences, and it's been an amazing journey for me. Quick overview of entertainment education as an approach. It's a communication approach, a strategy that allows researchers and practitioners of entertainment products to introduce health issues into entertainment programs in a very unique way that can successfully drive health-related knowledge, attitudes, and behaviors. And according to several studies, the main kind of driver of success for this type of approach is emotional involvement in entertainment content, which can play a key role for their success. And the experience of emotions through entertainment education has been essential to leading to specific health outcomes from tobacco prevention, preventing initiation of tobacco, to assisting with diabetes management and asthma management, and simply conveying risk, communicating the risk of different health issues from tobacco to HPV related, STIs and other health issues. And the series of publications on this topic has been tremendous since the late 80s, early 90s till today. So entertainment education programs can work, and the reason why they can work at 3 levels. They may be static with one-way communication. They may be interactive through human-computer interaction, and that's where games would start to play a role, or even socially engaging by allowing for a social interaction, even a community-level interaction, due to their engagement, due to them driving engagement. Now, in particular, when it comes to games for health take advantage of being interactive and socially engaging so they can promote health, prevent and diagnose or treat chronic diseases, or even train health professionals through simulations. So let's talk about some theoretical mechanisms used in games for health to explain their success. First, one model that can explain success of entertainment education in general and games for health as well is the elaboration likelihood model. Entertainment can persuade individuals to take healthy actions by allowing them to process information in one of 2 ways. They either focus on the surface features of a message, like who is the messenger and how enjoyable the message is, and we call this peripheral processing, or they can concentrate on the quality of the message argument and focus on the facts, which we call central processing. So with entertainment programming, there's an extended version of the model that explains how people's peripheral processing can promote central processing of information, taking this type of shortcut. And with this approach, players of a game can become socially engaged and motivated to start discussions about health with their social circle and engage in their community. And so this allows them to rehearse the healthy beliefs and strengthens their positive attitudes toward healthy behaviors by simply communicating with others about what they've learned through their entertaining experience. Now, based on the social learning theory, we know self-efficacy, or the feeling of confidence in the ability to engage in a certain behavior, is key to actual behavior change. And games for health are built predominantly to drive higher self-efficacy, allowing players to perform healthy behaviors in a safe environment and ultimately build confidence that they can engage in healthy behaviors in the real world, which allows them to transfer their experience and training in this virtual environment that we call virtual to the real world. In fact, theoretical frameworks of communication, such as the experiential learning theory, as well, agrees that both entertaining and interactive elements of a technology allow users to form a certain experience that motivates them to engage in certain behaviors and interact with others. And by exploring virtual environments and learning in this safe environment, this can create this experiential learning process. One great example of a successful game for health is Remission, which is a video game designed by the nonprofit organization Hope Lab. And it was designed to promote medication adherence among pediatric cancer patients. In this game, players control a robot called Roxy that you can see here in the video. This robot is injected in cancer patients, according to the narrative of the game, to fight cancer cells using medication as ammunition. And the results of a randomized control trial with Remission through several cancer centers throughout the US, as well as Canada and Australia and France, showed that players of Remission were more likely to adhere to their medication as measured through the frequency of vial cap openings to receive the medication, as well as from blood tests showing that medication's been received much better from those playing Remission compared to a control that received a non-health related game. And interestingly, self-efficacy played a key role here as well, showing improvement among those in self-efficacy among those who played Remission compared to the control. Further results of the study showed a mediation effect from being part of the Remission group toward improving in self-efficacy and improving in self-efficacy toward medication adherence, which was very interesting. Here. Okay, so in our lab, we've tried to readapt the game to test its potential impact on cancer risk communication with college students, considering that this game involves this high heat interaction between the player and actual virtual cancer cells that are multiplying and fighting the player's avatar in this virtual environment. We were interested in how challenge levels in the game would affect their perception of cancer risk and see if that can take them beyond that toward behavior change. And the results showed that college students who played Remission with some level of challenge in fighting cancer cells were more likely to perceive the risk of cancer, both susceptibility and severity. And they were more likely to seek information about cancer on campus by speaking with their on-campus clinic, which was very interesting as to how a game can transfer its experiential moments onto the real world and into the community to engage in discussions beyond its experience. Now, digging deeper into the mechanisms of action for Remission in this case, we learned that emotional involvement, again, is what allowed Remission to have its impact. But basically, this was noticed within specific events in the game. So by looking at how the game was able to create fear when attacked by cancer cells within the game, and then how players were experiencing some kind of a reward, some level of happiness when overcoming the cancer cells in the game, they were more likely to be provoked to think about cancer risk, which led them to change in their perceived cancer risk. The interesting part of this model, of this path, is that relationship between fear and happiness. And the reason behind that is of this association can be attributed to what we call flow state. And the flow state is when there's a balance between the difficulty of a challenge and our ability to overcome that challenge. And in successful games for health, we want to create that balance. And so the more they felt fear when they were experiencing the challenge of being attacked by cancer cells, the more they felt this reward when they were able to overcome the cancer cell. And we believe that this kind of association is key here to the success of driving these outcomes. So now games with human-computer interaction have elements of both entertainment and interactivity, but we still don't understand the differences in the roles of entertainment and interactivity separately when driving health outcomes. So that was really our next question. And we wanted to understand what are the mechanisms by which entertainment and interactivity can lead to health outcomes. So I conducted a study investigating the mechanisms by which entertainment and interactivity can be considered and examined through path analysis as well in the context of a game-based online intervention for tobacco prevention with adolescents. So we know well that smoking is a major health problem, causes more than 5 million deaths worldwide each year, and it's still the #1 preventable cause of cancer in the world. And adolescents are the most vulnerable to initiation and then subsequent, consequences of tobacco exposure, with carcinogenic processes starting early and potential transition to combustible products from vaping, as well as the dependence and the regression in mental development as well. Now, in the US, we have more than 1 out of 4 high school students that frequently use tobacco products. We're talking about 20 times or more in the past 30 days. And interestingly, in Ohio, 36.7% of high school youth reported currently using any type of tobacco product, including e-cigarettes. Even among Ohio high school students, we've got almost 5% reporting current cigarette smoking, which is pretty close to the national number as well. So early tobacco prevention is critical. There's no doubt about it. And Aspire is basically a game-based online program that involves both interactivity and entertainment, that is meant to prevent tobacco use, tobacco initiation among early adolescents, mainly 11 to 14 years old. It's an intervention that was designed by UTM the Anderson Cancer Center. It's available online for free, and there's even a newer version from this one that I'm presenting to you now. And it's been shown to prevent initiation after 18 months follow-up. A strong trial that was conducted in the early 2000s, late 90s. So it's not a new intervention, but there's enough evidence that applied even recently showing results as well. So Aspire includes both videos of testimonies from adolescents and patients, as well as interactive education activities. And I apologize for the transition here in my slides. It's been as well implemented with middle and high school students. And that's something I forgot to mention here. So it was designed based on the transtheoretical model of the stages of change. And it includes both entertaining videos that involve avatars as well as testimonies, and a storyline from several mini videos that take the adolescent through the experience of different tobacco-related issues. And game-based activities within Aspire are presented within small virtual environments that can be explored, as well as gaining points as you go along different modules of the website. So with funding from NCI training, R25 fellowship training, I conducted this randomized community-based trial to compare Aspire with a text-based control for tobacco prevention and understand better users' experience with the program when it comes to both interactivity and entertainment. So we built collaborations with the Boys and Girls Clubs in Houston, Texas, and the YMCA in order to conduct the study. And we had 4 locations of these after-school programs who serve more than 1 million adolescents throughout the state. So I conducted recruitment with a participatory approach. We had club members and team leaders and several adolescent volunteers and their parents take part in the recruitment process to make sure that we have a strong presence, as well as involve the community in our recruitment process, and make sure that all paperwork's been taken care of. And I can talk more about my experience working with after-school programs by the end of the presentation, which is a very unique, very sensitive and dynamic environment for community-based research. Now, following recruitment, we had 101 adolescents who completed the first assessment survey. Then they were randomized to either of the 2 arms and complete a simple post-test survey. And we were able to retain 80% of the participants. And the trial was followed with exit interviews, in-depth interviews with 20 randomly selected participants. And the goal of the interviews was to learn what were the most least favorite videos and activities and understand their personal and emotional experience with the program, and what they would change in the program for improvement. So early look at the results, we found that yes, we had a conditioned by time effect on the outcome of intention to smoke. And smoke was, we measured smoking, intention to smoke for cigarettes, cigars, and hookah and separately and combined the outcome measure. And we found that we had an effect on the outcome with Aspire, which was expected based on the previous trial that was conducted for Aspire. But we also noticed a role for emotional involvement in the program. And so we wanted to explore that even further in the context of entertainment and interactivity. So with that, we conducted a path analysis where we tried to understand the role of perceived entertainment value in Aspire, feeling present within the environment of this website, and experiencing an emotional involvement that could lead to intention to smoke. And the results were, as we expected, driving intention to smoke through this path, but particularly perceived entertainment had a more of a direct effect onto emotional involvement than to necessarily drive further a feeling of being present within the environment of the program. And that then led to lower intention to smoke. On the other hand, when it comes to perceived interactivity, we noticed an even further direct relationship from perceived interactivity toward intention to smoke. But the mechanism by which we saw emotional involvement taking place was through perceived presence when it came to perceived interactivity by interacting with the environment online and engaging with this virtual world. Players were more likely to feel that they were present in that virtual world and ultimately experience these emotions that were interestingly not found to be significantly related to intention to smoke. So that direct relationship for perceived interactivity toward intention to smoke was very interesting. Now, although not analyzed here, our next interesting analysis that we'd like to conduct for this path analysis is to consider both interactivity and entertainment within the same model. And this will probably involve another study with a larger sample size to be able to have the power to conduct this type of analysis. However, by combining both within the same model, we will be better equipped at looking at this interaction between interactivity and entertainment. We'll be very excited to do that as a next step. Now, in addition to human-computer interaction, games for health can be socially engaging. And so through this social engagement, both social support and social influence can have an impact on health behavior change. We know well that that's obviously the case for smoking as a learned behavior. We know as well that negative influence from a social circle can lead to initiation of smoking. And that's supported by several learning theories, social science theories, such as social learning theory and other social ecological models of behavior change. But there's also empirical evidence that adolescent smoking initiation is associated with personal social network of friends. Several social network analysis studies have shown befriending others who smoke can lead to initiation of smoking, but also mere proximity to others to peers who smoke among adolescents can predict initiation as well. So now, alternatively, an environment that is supportive of healthy behaviors may be able to promote positive influence and maybe social support, then allow adolescents to see that others like themselves are against tobacco use. And by shifting those norms, there may be a possibility to prevent tobacco use through social influence. So as a result, we still don't know how to design and implement, though, an intervention that promotes positive influence. We're still experimenting with this type of intervention in the literature. Is still not clear as to the power of positive influence due to the several different studies that have been conducted trying different strategies in trying to push for positive social influence, positive support within these interventions. And this is particularly in the context of tobacco prevention with adolescents. For most, it's been mainly to take advantage of peer leadership and assign those adolescents that are nominated to be leaders in the classroom to take a part in social support and positive influence. However, there's been a bit of difficulty in that regard because a lot of famous, quote unquote, celebrity peers in the class who are nominated mostly as friends and leaders can be tobacco users as well, and maybe actually promoting tobacco use. Other studies have considered looking at cliques of adolescents who nominate each other as friends to see if we can group those groups of friends in their own bubbles in the classroom setting and engage them with health promotion content for tobacco prevention. However, that's also backlashed a bit with unintended effects where we tend to select our friends as well, because if we are users, we can tend to select friends who are also users. And so we ended up with these groups of tobacco users sitting together and groups who do not use at all sitting together as well. And that created a kind of a difficulty in boosting for that behavior change. So to tap on this gap in knowledge and these difficulties and challenges, my team went on a mission to design a social game for tobacco prevention. We called this game Storm Heroes, and this game includes social activities that foster exploration of health info and drive discussions against tobacco use, and a social network intervention within that program strategically groups adolescents who intend to use tobacco with several of their close peers who do not intend to use tobacco, that we call change agents. So each person in the classroom who intends to use tobacco in the future would be seated with several who do not, so dominated by others who do not. And the game would engage them in discussions that are against tobacco use as well. We hope that this strategy would shift social norms and allow for these positive discussions on each roundtable, so that we can promote a healthier social circle. So Storm Heroes, as a quick overview, it's a multiplayer cooperative board game. We decided to go for a board game instead of a digital environment at the beginning of our design, because we wanted that human-to-human interaction, and engaging in the real world with actual objects in front of us. And I think that's key here to the success of this interaction, of building those new friendships for these adolescents. The health content is developed based on the processes of change from the trans-theoretical model of behavior change and based on the protection motivation theory. We designed 367 unique anti-tobacco messages for adolescents. You're doing a co-design, participatory design approach with a youth advisory board that we call the Youth Design Board. And they met on bi-weekly basis to advance the content of the messages and their framing strategy, as well as collaborate with the designers on the graphics and design of the game itself and its mechanics, which we've built mainly on the experiential learning theory and the flow state model that I've described a few slides ago. So in this game, we have 3 to 6 players who collaborate to win the game by engaging in a series of activities as a team, being cooperative. Adolescents within their group, they are collaborating to win this game. However, between groups, between roundtables, they can be competing for winning the game and gaining the most points in this game. Adolescents play the role of a group of friends living on an island. And the storm hits this island, bringing with it a flurry of dark magic and spreading tobacco products and disease-causing chemicals all over the island. And so in order to save the island from the storm, these players go on a quest and they engage in these activities to save the island and their neighbors. And through that quest, through that journey, they would end up exposed and experiencing the content, the health information that we had designed for them. We have several types of activities that they can engage in through the game. We have teamwork cards. These are when they face an incident, specific incident on the island. They have to make a group decision on how to face that incident. And the way they face it could result in a positive consequence or a negative one. Storm cards are picked as trivia questions about tobacco and environmental health. And we're putting tobacco under the umbrella of a environmental health type of storyline, so that we are creating this subtle engagement in tobacco-related content, as opposed to it to feel that it's mainly predominantly about tobacco prevention. And we call this a way of lowering perceived persuasive intent. So we want players to feel that we are not trying to persuade them through this communication strategy. In addition to this simple interaction and discussion type of cards, the teamwork cards and storm cards, we have mini game cards that are more of a physically interactive type of activities. Charades, obviously acting out a word or phrase that others in the group have to guess, speaking out. would describe and convey clues about a word or phrase that others have to guess. And drawing, so a player at the group will have to draw the word or phrase that others have to guess. And as they win with these activities, they are clearing the island from diseases, and they get to add healthy badges to their board. So with funding from K99R00, we wanted to evaluate the short-term efficacy of Storm Heroes by comparing adolescents who are randomized to Storm Heroes with those randomized to Aspire, particularly because Storm Heroes design and content and modules match well with the Aspire modules, and both were designed based on the exact same processes of change from the transhierarchical model. And this comparative trial involved a 1.5-month follow-up. It's also being conducted in after-school programs. We've recruited 14 after-school program locations that allow club members and team leaders to participate in the recruitment process. We had adolescent volunteers as well participate in recruitment. This was a very difficult trial for us. The challenge was mainly due to COVID. It took us a while to go through a lot of new guidelines as far as interaction between us and research participants in these locations. Some locations had to close for a while before we were able to start recruitment, and so on. So I can say that it was a very interesting and learning experience for me personally as a junior faculty. It was an experience that allowed me to understand better ways how a trial can evolve over time and on the spot to become what it is by the end of the project. After randomizing, the participants got involved in 5 to 7 sessions. There are 5 sessions with 2 booster sessions of the program. Each session was 45 minutes long, and they had 1 session per week until the program was done. This is, of course, with a plus or minus 2 weeks due to the different challenges we had to face with these locations. So it wasn't a systematic, uniform type of dosage for all sites. But this was well balanced within arms. We assessed several, we had several assessments within our surveys, pre, post, midway through the intervention, and at follow-ups. But just to name a few that are key here, there are individual measures that we've tapped on, including tobacco use, intention to use tobacco, which is our main outcome in this case, being a short-term trial of efficacy. We did look at, though, tobacco risk perception, temptation to use tobacco, and their ability to resist trying tobacco for the first time. Social measures were also examined. We got information about their self-reported quality of discussion against tobacco during the program, as well as that outside the program. And we also got a great dimension of data that is amazing, which is social network data of their friendships within each class. The social network data was key at the very beginning because we introduced this data to an algorithm that allowed us to be able to group the participants based on their social network of friendships and obviously their intentions to use tobacco. But this also allows us to measure over time their potential change in friendship formations, not to expect that they would lose the friendships they have, but at least build ones that would support them in their journey to staying tobacco-free or becoming tobacco-free. And we wanted to understand that that social network dynamic over time to be able to see if we can capture unique exposures and connections between adolescents that can explain our outcomes. Now, we are in the midst of analyzing this data, and we're very excited to be doing so. In fact, the whole statistical team is right now working on the data. I promise we want to be publishing this as soon as possible. But following this trial, we see our plan to be much bigger than this non-digital version. And we want to be able to develop and test an advanced version of Storm Heroes that is digital in several aspects while staying in the classroom. We want to be able to allow for this digital version to be fully electronic and automatically group adolescents based on their social network data so that we don't have to receive that in-house to be able to run it through the algorithm. It can also tailor based on gender and culture, and there's enough evidence that adolescent tobacco use is gender affected. The mechanism of behavior change for tobacco prevention is gender-oriented and culture-oriented. And we want this to become accessible via mobile phones as well, and see if we can create a version that is more simplified, that can be accessible outside the classroom as well, if possible, to examine things beyond a classroom setting, but also capture this transference of experience from the virtual world to the real world and capture that actual change that's more ecologically valid. So we can imagine how wide the impact of games for health can be and can get from the individual level on learning from exploration through a gaming environment, but also at the relationship level, learning from others and engaging in discussions with others during and after an entertainment-based experience like games. And at the community level as well, where we can share with others in our community and advocate for health behavior change. In fact, one of the outcomes that'd be very interesting for our Storm Heroes project is to take a look at this wanting to convince others and promote a tobacco-free lifestyle, or even become members of advocacy groups beyond the school, beyond the program, beyond the school, in their broader community. So that pretty much sums up my presentation. I'd like to acknowledge all of those responsible for making our projects possible, including our partners, the funders, of course, my senior faculty mentors, and other members who had a key role in actually executing the program. So thank you.
Thank you so much, Dr. Khalil. I see rounds of applause, and I will share my own. Thank you for such a great presentation. As a reminder, we welcome you to come off of mute and ask Dr. Khalil your questions. Turn on your cameras and let's engage. We do already have a question in the chat from Dr. Scott Frank, who asks, how do you support positive social influence without stigmatizing and labeling smokers, as the villains, and driving a wedge between smokers and non-smokers? And Scott, I've just seen that you've come on. I don't know if you want to add anything else to the context of that question.
And I would say that traditionally in tobacco prevention, we try to frame the tobacco industry as the villains. And I'm just wondering if the positive social model approach frames smokers rather than the tobacco industry as the villain.
That's a great question, Scott, and thank you for this. In fact, I think that what helped us stay away from this issue, which is a big issue, and I agree, is fiction. And through fiction, not only we are creating an entity that is kind of confronting us, but it's also an entity that's not necessarily a person. So the storm that they are trying to fight, there's a mystery behind that storm. Is it coming from smokers? Is it coming from the industry, tobacco industry? We keep that mystery in the game to allow for this interaction to happen and to allow for this open-ended question to stay in their mind and provoke their thoughts beyond the game. I tried as much as I can with this design to avoid pointing a finger, but more to promote this game-framed approach where, by staying healthy, even though we are fighting a storm and the storm is devastating, look at the positive outcomes of the storm. And when it comes to the real world, where on their tables sitting together, it's important for us not to label anyone by anything. So none of them know the mechanisms by which they're grouped. The algorithm knows so. In fact, at some point, this algorithm is going to turn from transferring being a machine learning algorithm to an AI, where we won't be able to even know how they become grouped. So we're collecting big data, network data, on social network data, and tobacco use and intention to use, so we can start that training of the system for it to discover best ways to group adolescents in a classroom to invoke this. And this is really a starting point. So with this algorithm that we have now, we're going to be learning much more to move forward with that. But the idea is that it's a black box. And so to them, they're being grouped the way the teacher would like them grouped. And they're engaging together in these discussions without labels. And the play environment is supposed to drive their discussions to be against tobacco as an entity, as a product, and not against individuals or big companies. Now, there are messages that do portray tobacco industry as having done certain things that we want to avoid, and that strategy is played really well for persuading adolescents to wanting to not only avoid tobacco for themselves, but also advocate against tobacco in their communities. Because at the end of the day, we cannot hide the truth about the history of tobacco in its business and its industry, and we want them to be aware of the facts, and we simply present them as so. And so we try to highlight this as a risk communication strategy as opposed to a persuasive methodology.
A great answer, very thoughtful and insightful. If I could just follow up, inevitably you're going to, if this game is given in public settings, after school programs, schools, so on and so forth, you're going to have smokers in the group that are playing games. How do you imagine a smoker would feel participating in this game?
Yeah, it's interesting. And our focus group discussions where we had smokers on the table, adolescent smokers, and vape users, and non-users, really the interaction happens without us. And it feels that those who do use tobacco, adolescents who do use tobacco, are very open to share so when they're in an environment that they feel is safe. And the point of the gameplay is to create that safe environment. We hope that that's going not necessarily allow them to be in an environment where they would necessarily bring it up that they are users, but at least and from what we've noticed, and those are only anecdotes from the team when we've been moderating the sessions of the game with adolescents in the community, we've noticed that several adolescents were tended to be listeners more than speakers. And we got enough observational data to take a look at that further with the data, that the quantitative data we have, to see if the groups that got engaged more had maybe a different status of tobacco use versus those that got engaged less, and understand that type of interaction and dynamic that's happening on the table based on their status. That's going to be difficult, but I think that's important. And Scott, you're bringing a really good point here, because we want to make sure that it's a safe learning environment, as opposed to a debate type of roundtable. And one thing that helps us with that is the rules of the game. So with games, the kids want to win, regardless of what the game is about. And they want to get somewhere with the game. And they're playing together to win that game. And the only way they can win it is if they play together well. And the game is trying to moderate the interaction. Now, the reason why we want to move digital is because a board game is difficult for it to moderate, and it's being self-paced by these adolescents, because they are controlling the countdown and the next card to play and the length of discussion on each activity. Whereas in a digital game, there's a robotic moderator, a robot moderating the whole interaction, that will allow for only this positive spirit to move forward if they want to win. So I think that's key. Absolutely.
Thank you.
Thanks, Scott.
Thanks for those great questions, Scott. Jen, I see your hand up.
Yes, thank you so much,
Jen.
George. I'm curious, this is so fascinating. I'm curious, how long does a typical game last? And does that have an effect on these outcomes that you're measuring, whether it's intention to smoke or intention to not smoke, or actual smoking behavior?
Yeah, absolutely. If we're talking about Storm Heroes, Jen, if I let them play, they can go on playing forever. So really, the game is for them to be able to reach a certain point of victory, right? Or loss, either or. And for them to reach, so they're playing against time. So kind of like, I don't know if you're familiar with the board game Pandemic, where the whole world has diseases and you want to create this vaccine that will save the world. Funny, this game came out even pre-COVID, much pre-COVID, and yet it's very, very common. I really encourage you to check it out. But the idea is they have these 45 minutes for a session. They have to get the highest score they can get during these 45 minutes. And then they have the next module and the next kind of like chapters of the story, every module, tapping on new content. As far as testing for outcomes, we hope to see that it will reduce intention by post-test and by 1.5 months a follow-up. We don't know yet, so the analysis is now happening. For Aspire, we did see that very well, and the theoretical framework is similar, so we hope to see the same here. Expectations as far as this comparative trial, similar outcomes in reductions. I do not honestly expect that Storm Heroes would perform better than Aspire, but that means that we are talking about a fully digital program and a board game, and they're both performing as a hypothesis, both performing equally well. That means that we can see benefit of digitalizing the program to go beyond that, and maybe even introducing some Aspire content within Storm Heroes in collaboration with MD Anderson. But expectations are reductions. Now, what really worries us about these reductions is the flooring effect of intention being reduced to the point that there's no space for it to go lower. But I think that there's this kind of reaching that flooring effect is success for any intervention for tobacco prevention. If we reach that effect, the argument is that we're ready to see if initiation can be prevented at long term. So we can say we're ready for an R01. We're ready for this long-term trial that can take a look at actual behavior change, actual incidence of initiation being lower for those who get a smoke heroes versus those who get a control condition. And that's where we want to get as the kind of outcomes we're interested in. Did I answer your question, Jane? I don't know.
Yeah,
if the
yeah.
second
Thanks,
part is-
George.
Okay.
Thank you.
We can definitely talk more about this post-presentation.
So I actually have a question. I loved hearing that you're working with after-school programs. I know I have at least one colleague on who does a lot of work with out-of-school time organizations. I'm wondering about how you sort of think beyond the structure of what you've done now. How are you thinking about disseminating to other sort of settings where youth may be able to engage with these games?
Yeah, good question. Thanks, Erica. I find that as a board game, dissemination is going to be very tricky, and that's another layer of benefit for digitalizing this game. But it can play a key role in the typical classroom of after-school programs within their teen room. And after-school program, all after-school programs have a teen room just for the teenagers where they can read, play social games. They have a lot of board games in there already, which was very intuitive to them. It was seamless to have it implemented in after-school programs that way. When we want to consider larger impact and maybe even go beyond after-school programs and into the community in a way that is more sustainable, obviously, with adolescents, we cannot not think about schools and allowing a game to turn into a full-blown program, but also a program to turn into a curriculum. And that's really the biggest of challenges. I think it warrants its own research study, its own funding, and it will definitely need collaborations with education science researchers and collaborators from the community, from school districts, would be interested in vouching for this, because playing around with the modules in a way that is comfortable for the teacher and being able to create a teacher-tailored type of program is not easy. It will dictate a lot of changes within this one, but it's very doable. And I think that's the best way to go if we were going to need that stepping stone of implementation science research before this would go on to school setting.
Thank you.
Thanks, Erica.
Yeah. Any other questions from our audience? And I know we've lost a few with the 1 o'clock hour, but I want to make sure to give a chance to anyone who's still here who'd like to ask a question. Well, if not, I'd encourage you all to turn on your cameras and let's again thank Dr. Khalil for his wonderful presentation. Great hearing about your work today. Thank you so much for being with us virtually. This is again another reason why I really appreciate that we've moved virtual, because we can host you from your own space in Florida and learn about your exciting work without all the navigation of getting you here and saving all of our time. So thanks again to everyone for joining us today. And as a reminder, we will post this on our PRCH and YouTube channel. And we hope to see you next month for our April presentation. Have a great afternoon, everyone.
Thank you, everyone.
Okay. Thank you so much. Let me know if you need a letter or anything to your chair, if that would be helpful as an appreciation for your time and the presentation. Happy to provide that. I know these are, I like to provide these especially for junior folks who, you know, are building up to the next step. So let me know if there's anything I can do.
Thanks,
But thank
Erica.
you.
Thank you. Yeah.
Yeah.
Yeah, absolutely. I'd really appreciate a letter, if that's all right. And I can email you more about that and what's expected here in our department. But thanks for having me. It was really a blast having, presenting this.
Yeah.
I really hope they enjoyed it. And I don't know if they have my email address, but I'd be happy to answer their questions or connect with others for folks for collaborations if they'd like to. So
Excellent. Excellent.
yeah.
Well, a sure sign of success to me is when we have new names that I've never seen, and we had a couple of those today. So there are definitely people who came to just see what you presented, what you're doing. So
Awesome.
that's a win in my book. So thanks again, and hopefully I'll see you. Well, gosh, next year SRNT's in Scotland, so I'm not sure if you'll be going
Awesome. That's really cool.
internationally. Yeah, but if you are, we'll definitely have to meet up.
Yeah, absolutely. And who knows, maybe earlier. So
That would be lovely too. All right, have
and
a
Kate,
great
thank
day.
you. Thank you, Kate, as well for helping out here. So
Yeah.
bye.
All right, have a great day, George. Bye-bye.
You too. Bye.